Hi, I'm Dr. Joel Cherdak. One of the questions I often get from patients is, are peptides really the fountain of youth? And can they really reverse aging? So the answer to that question is somewhat nuanced. When patients start peptide therapy, we can improve some of the function that's been lost due to aging and restore the body's ability to function at a more optimal level that's reflective of an earlier age. But you still continue to age. So when we start peptides, we can restore some of that function, but you're still going to age over time. And the goal of peptide therapy is to help you age more slowly in a more healthful way over a longer period of time. So let me just give you some examples of what I mean. So when we start patients on growth hormone stimulating peptides, peptides like ipamorelin, samorelin, tesamorelin, CJC-1295, they all do the same thing. They all stimulate your pituitary gland to produce more growth hormone. And that higher level of growth hormone is reflective of what your body was able to produce before you started to age and before those levels started to decrease. And those levels start to decrease somewhere between 30 and 35, and they decrease by a certain percentage every year. So with respect to growth hormone stimulating peptides, yes, initially we actually sort of reverse the biological clock to have you produce what you were able to produce when you're younger, but you're still going to, over time, decrease your production of growth hormone. And the peptides are meant to slow that decrease and slow essentially the aging process. Another example is collagen in your body. So as we age, the linkages between the collagen fibers start to lower in number and decrease, which is why you see fine lines and wrinkles on your skin. And also the collagen integrity of the internal parts of your body starts to diminish over time. And so with a peptide like GHK-Cu, what happens is the copper in that, the Cu, increases those linkages of collagen. So it brings you back to a little bit of a younger period of time when your body was able to produce more linkages in your collagen. But over time, those linkages are still going to diminish, and the goal of the peptide is to slow that process and to have you age more slowly in a biological sense. Another example of that would be peptides like BPC-157 and TB-500. Peptides that increase the flexibility and the integrity of soft tissues and ligaments and tendons, and also start healing them. So as we get older, obviously, your tendons and ligaments, your rotator cuff tendons, they start to get more rigid and they start to decrease in flexibility. And so by adding a peptide like BPC-157, you increase the elasticity and you increase the strength of those tendons. So again, you back things up a little bit to a period of time when those ligaments and tendons and the integrity of those structures were stronger. But again, they're still going to diminish over time, and the goal with the peptides is to slow down the progression of the diminishing of the function of those tissues. Another peptide that really helps with slowing the progression of aging is Epithalon. So a lot of people haven't heard of Epithalon, and what Epithalon does in terms of slowing aging is it activates an enzyme called telomerase. And so telomerase acts on the telomeres, and the telomeres are the ends of your chromosomes. And you can think of it as the plastic cap on a shoelace that keeps the end of the shoelace from fraying. And so as that cap diminishes, the chromosomes start to degrade, and every time your cell divides, there's a little bit more degradation of the chromosome in the DNA, and that continues as your cells divide, and your cells are dividing all the time. So that's one of the things that causes people to age. And by activating telomerase through the use of Epithalon, you slow that degradation of the chromosomes, so it essentially keeps your body from aging at as fast a pace as it normally would. And there's other examples of these as well. I just wanted to name a few. So the overall goal with our clinic when it comes to peptides as it pertains to anti-aging is that we want to slow the aging process, have you age in a more healthful and a more slow manner, and have you maintain function and health as long as possible. So our goal isn't always necessarily to make our patients live longer. The goal is to make sure that as patients age, they retain function, they retain mobility, they retain cognitive function, and that they age in a more healthful way so that you have more quality years of life. So, essentially it's using peptides to increase quality of life over quantity of years. If you are interested in being part of our program for anti-aging through the use of peptides, click on the link on the bottom of the description of this video, which will take you to our homepage where you can request a free consultation with our patient coordinators who can answer any of your detailed questions that you may have. We look forward to hearing from you.